Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. My email is cklpm@gmail.com. Today we are going to talk about a very interesting topic, the functional visual loss or the non-organic visual loss and color vision. The non-organic or the functional visual loss. So how can we differentiate from a non-organic visual loss and an organic visual loss? A truly blind person can sign his name without difficulty. A truly blind person can sign his name without difficulty, whereas a functionally blind patient often cannot. A truly blind person asked to look at his hand will look wherever the proprioception tells him his hand should be, whereas a functionally blind person may gaze in any direction and perhaps never where the hand actually is. This is known as Schnitzler-Rimpler test. A truly blind person can touch his four fingers together without difficulty. A functionally blind person may make half-hearted, inaccurate thrusts. The presence of normal visual, the menace reflex, that is when a threatening impulse comes, person immediately closing his eyelid, or the pupillary light reflexes excludes organic blindness. So the presence of normal visual, menace, the pupillary light reflexes excludes organic blindness. And two other important points to exclude non-organic or functional visual loss are the presence of optokinetic nystagmus and the visual evoked response. What is this optokinetic nystagmus? Optokinetic nystagmus is a normal phenomenon when the person is able to look. It is the pursuit movement followed by a corrective saccade. Pursuit movement followed by a corrective saccade. We see this when we sit in the train and watch the scenery, or at the bedside it can be tested by giving a roll of white and black striped papers and rotating it. A normal person, if he is able to see, he follows the black and white stripes. So there will be pursuit movement with a corrective saccade. Pursuit movement with a corrective saccade. So if a person has got optokinetic nystagmus, that means he is able to visualize it. A person who is acting that he is blind, he may say that he is not able to see and he is blind. But when given this optokinetic test by giving a rotating drum, he may pretend as if he is not able to see. But since his vision is there, he is actually following the black and white stripes. So you can see the pursuit and corrective saccade, and there would be optokinetic nystagmus. So the presence of optokinetic nystagmus rules out blindness. Another important test is the visual evoked response. So we give a flickering light and measure the latency. If the latency is prolonged, that means the optic pathways are damaged. But if there is the visual evoked response is present, that means he is able to see. Unless he is able to see, we will not develop visual evoked response. So if there is visual evoked response or optokinetic nystagmus, it indicates the person is not blind. But sometimes persons may even try to overcome this optokinetic nystagmus. So another excellent test is to have the patient look into a large mirror that can be held and moved. Tilting and moving the mirror will elicit optokinetic responses because the entire environment is moving. The patient cannot suppress or blur out by willfully failing to fixate on a single target, as he may be able to do with optokinetic nystagmus or VER. So this is still a better test, an excellent test, by tilting and moving the mirror, checking out on the optokinetic nystagmus. Right. So these are all the ways wherein we can differentiate a non-organic visual loss from an organic visual loss. The next topic we are going to discuss is the color vision. Color blindness, achromatopsia, is an X-linked condition present in about 3% of males. Color plates or pseudo-isochromatic plates, Ishihara, formally and quantitatively assesses color vision. So amongst many colored dots, there would be a hidden number. A person who does not have color vision will be able to identify the number. A person who's got color vision, he will not be able to identify the number, the hidden number. So these are all Ishihara charts or pseudo-isochromatic plates by which wherein we can test a person has got color blindness or not. The most common hereditary dyschromatopsia is an X-linked red-green defect. Acquired dyschromatopsia may result from macular, retinal, optic nerve, chiasmal or retrochiasmal lesions. In fact, even drugs can cause color blindness. Example, ethambutol, acquired color defect. The monoocular loss of acuity, defect in color vision, and an afferent pupillary defect are highly characteristic of an ipsilateral optic neuropathy. The monoocular loss of acuity, defects in color vision, and an afferent pupillary defect are highly characteristic of an ipsilateral optic neuropathy. Because optic neuropathy affect the macular fibers, patients lose the ability to read the isochromatic plates. Red perception is usually lost first. Impaired color vision with only mildly reduced acuity is suggestive of optic neuropathy. So if the optic nerve gets affected, there is impairment of visual acuity and color vision, but more of color vision is affected. Whereas if it is a macular lesion, more of visual acuity gets affected, because macula is primarily responsible for the highest visual acuity, and therefore color deficits associated with more severe acuity loss suggests maculopathy. So impaired color vision with only mildly reduced acuity is suggestive of optic neuropathy, whereas color deficits associated with more severe acuity loss suggests maculopathy. We have night blindness, we have day blindness also. Day blindness is otherwise known as hemerolopia. Day blindness is a condition in which the vision is better in dim lighting, night, than in the bright day. It occurs in various conditions causing a central scotoma or early cataract or as a rare side effect of trimethadione. Night blindness, Neutralopia. Night blindness is much poorer vision in feeble illumination than occurs normally. It is common in conditions like retinitis pigmentosa and can occur in chronic alcoholism, Leber's hereditary optic neuropathy, and xerophthalmia due to vitamin A deficiency. So these are all the important concepts of non-organic visual loss and color vision loss. I hope you have enjoyed listening to my lecture. I put a lot of important neurology concepts in my book Focused Neurology, published by CBS Publishers and Distributors. It is available online from all leading booksellers including Amazon. If you are interested, you can buy it online. These are all the important concepts of the non-organic visual loss. I hope you have enjoyed listening my lecture. If you have any suggestions or comments, you can post on to my email sreeklpm@gmail.com or to my YouTube channel. But please like, share and subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.